You are watching the Doctalk show. Cut out unhealthy habits like smoking and drinking alcohol. Smoking and drinking are extremely bad for your health and directly related to increasing your non-communicable disease risk. Smoking increases your risk of heart problems, increased blood pressure, cancer, diabetes, and breathing problems. Not drinking is perhaps the best possible health choice you'll ever make. You are watching the Doctalk show.
So more than 40% of Ugandan deaths are attributed to non-communicable diseases. The major ones include heart disease, cancers, diabetes, strokes, and chronic lung diseases. So this is definitely a growing concern to everyone. Whether you have suffered from it before or your neighbor or your family member is suffering from an NCD, it definitely has a big impact on you. So I want to explore what the impact of NCDs has on first an individual, if it is you who has it or someone you know has it, and also at a community level and at the national level. So start with Dr. Lumu. In your experience, you interact a lot with patients who suffer from these NCDs, diabetes, cancer, or heart disease. What is the impact of this disease on these patients?
A patient can get a stroke, and a stroke, this is one side of your body getting weak or paralyzed. So one problem is stroke. The second is eyes. Eyes can be affected by diabetes, can be affected by hypertension. Even some cancers can affect eyes.
Okay.
And when eyes are affected, you lose sight. In fact, diabetes is one of the leading causes of blindness globally. You can have NCDs coming from the heart itself, or you can have other NCDs like diabetes, hypertension, and cancers affecting one's heart. So the other problem with these NCDs, they impact our kidneys. Diabetes, hypertension, even some cancers, and even chronic obstructive pulmonary disease, they can affect kidney function. NCDs can affect one's blood vessels. And if they affect one's blood vessels, the blood vessels can get clogged or blocked. You won't get blood supply to your limbs, to your legs. What will happen is you might lose your limbs. If you look at diabetes, it's a leading cause of lower limb loss or amputation.
When they cut off somebody's
leg. And actually, other organs I'd forgotten to mention about is the intestines.
One important one at individual level is impotence.
Even impotence.
Yeah.
The sexual performance.
Yes.
Power failure.
For the man. Does it also affect the lady's ability to deliver?
I don't think so, but it may, because it affects the nerves. And once the nerves, which is the wiring of the body is affected, all those things, even the mood can change.
Everything can change.
Don't have the appetite for it. But for men, really, the third leg becomes affected and may not perform.
Aside the individual, how does it impact on someone's, for example, someone's family, someone's community? What is the impact of NCDs? Dr. Tony?
Yes, from the community perspective, some of the things that we have observed are that because the way people live, they tend to not to live as individuals, but as a family and as a community. So let's look at a breadwinner, okay, who is either a father or a mother failing or getting one of these NCDs. And we know that in our country, at the moment, everybody has to pay for health care. What does that mean? Is that the little that they have, they will tend to spend that money on medicines because these communicable diseases may be something that we've not looked at in detail. They go on for life. You know,
they're almost permanent.
They are basically permanent diseases.
So once you get the diabetes,
you have to be on treatment basically for life. Hypertension may be on treatment for life. It is cancer. So we've seen the impact of this on household income, and as a result of that, if a breadwinner is affected and they're spending much of their resources on health care, the tendency is that the children who otherwise would have supposed to go to good schools will not be able to access school. So we've seen that as the biggest problem. And it's not only for the poor that affects, but even what we see as the rich. You know, there is this definition of the rich poor. You are rich today and you just get a cancer and all your resources are just depleted in one moment. So you're rich on one end.
If the rich person has that risk, what about the poor man? What do they do in that case?
Of course, the poor man, the situation is dire because they either have to go to the lowest level possible. And of course, as UPMB, we have facilities up the lowest level, 2s and 3s. And the challenge, of course, is that at the lowest level, we don't have access to these treatments or these services.
For us at the central level, we depend from, at family and community level. So when people are not productive, it means they are not able to pay taxes, and we don't get money to pay health workers, to do many other things. But the complications of non-communicable diseases are very expensive to manage, and they have really depleted our budget. We put a lot of money in Uganda Heart Institute, Uganda Cancer Institute, so it affects the economy. And for us, the drug budget and the health budget, a lot of it goes to manage those complications, which would have gone to make people healthier and more productive. So the NCDs are that bad.
Yeah, that bad. That's on top of even fighting the malarias and the pneumonias, so which we still have.
It's taking a big percentage of our resources, which would otherwise be used to keep people healthy.
What people should do, both as an individual, as a community, or what the government is doing to ensure the fight continues, to ensure that NCDs remain down, it doesn't increase stress on people's levels. So maybe from the government,
thank
from
you
the
very
government's
much.
viewpoint.
I had already started mentioning what the government is doing.
Okay.
Mainly is to address the risk factors, really.
Okay.
To address the tobacco, we have the tobacco law in place. And I've said we have banned shisha and electronic cigarettes and all those, but we have also banned smoking in public places. At the alcohol level, we have an alcohol control bill that has been passed by cabinet. It's going to be debated by parliament.
What does this bill state?
This bill limits the time you can consume alcohol. It's only in Uganda where you can drink 24/7. We shall reduce that to people to have some fun from maybe 5 to around 11. Secondly, alcohol to be procured or to be in a car shop and you buy alcohol. Thirdly, alcohol must be packed in containers not less than 200 mils. We are trying to limit access of alcohol to minors, to people, or it should be difficult even for adults to access alcohol. We shouldn't make it so easy. Okay. I went to a district and I was visiting schools, and I found teachers and pupils drunk because they could afford to access alcohol of 200, 300 from the canteen, from the school canteen.
Okay.
So all those we are going to control. So that's about alcohol. Then the other one is really sensitization, and this is one of the opportunities. We are doing sensitizing the public. Our studies, which we did in 2014, we are yet to do another NCD survey. We found that 76.1% of people with NCDs didn't know that they had NCDs.
That's almost 3/4 of the people.
Of the people who have NCDs don't know they have NCDs. So one of our responses here is to do sensitization, to make people aware that yes, NCDs are a big problem, and this is what causes them. This is how we can avoid them.
Okay.
Yeah, but the other thing is to avail opportunities for screening. And I think our partners, UPMB, will talk about more.
Yes, we shall talk a bit more about that.
Giving opportunities for screening so that people know they have a problem and they can come to our health facilities.
Okay, so addressing those risk factors, the 4 main risk factors, the poor diet, drinking, smoking, and physical inactivity, can help you fight NCDs or non-communicable diseases. More about this coming after the break. Send in your questions and comments on our social media platforms and Facebook and Twitter. Don't go away. We'll be right back.
You are watching the Doctalk Show.